Hi, Quinn.
Hi.
Nice to meet you. I'm Dr. B.
Nice to meet you too.
So we're here for a hand exam today, correct?
Yes.
And you are first-time patients. We're going to run through some basic information as well. And confirm your name for me.
Quinn.
Okay. And you know what you're here for today?
Yes.
Okay, great. So we will be looking at all functions of the hands, the skin of the hands, strength of the hands, really an overall look at what's going on. I'm taking a look right now as we speak. I can see some beautiful tattooing, which is wonderful. Looks great. Nice and healed. During the exam, I will also be touching you physically to see if everything's functioning properly. Is that all right?
Yes.
Okay. If at any time you feel uncomfortable, please let me know. Let's start off sanitizing my hands. Do you currently have any pain that you're experiencing at this moment?
No.
Okay. And what about history of injury or pain with the hands?
No, nothing.
Okay. So this is more of a preventative visit then?
Yes.
Perfect. So first thing I'm going to do is look, and I'm just going to spread them apart. You can relax. Noting symmetry. Obviously you have all 10, which is great. So I'm feeling for the texture of the hands in addition to the temperature. They're nice and warm. A little cooler in the knuckle area, but the fingers are good. So I'm not too worried about issues with circulation, but we'll double check. Here. And do you have any tattoos on this side?
No.
Okay. Just want to make sure I look at all of the skin. So tattoos on the hands are nice because we're not getting a lot of shifting and growth in the hands, so they shouldn't change too much. Do you ever feel any numbness or tingling in the fingers?
No.
Okay. What about any cold fingers, especially in the winter?
Sometimes.
Just look up at your wrists. Next, I'm going to be feeling every joint, starting with the wrist joint. If any of this is painful or tender, let me know.
Okay.
Also feeling the muscles. Okay, that's fine. Same thing here. A little popping on this side. So we've got 3 joints in every finger except for the thumb. We just have the 2. Okay. Next step is to check for circulation. So I'll first be listening to a couple pulses in the hand. to just make sure I'm hearing the blood flow of the fingers. Should be pretty hard to hear. It's not a super strong. Good, just relax, breathe nice and steady. Okay, you really shouldn't feel any pulsing in your fingertips. That could be a sign of high blood pressure, actually. So, okay, the next circulation test is slightly uncomfortable, but I'm going to have you pump your fist. I'm going to kind of hold you right here and kind of pump, open and close a few times. You see how the hand's turning white? One more time. And we're getting good return. A bit later here, but not nice and pink. And then we'll check it on the front via the nails. And those are great. And we're going to do the same thing over here. I'm going to hold the wrist, pump a few times for me. Open and close. Open and close. And once. And that one comes back really fast. Okay. So circulation is good. We'll take a temperature. 96.5, 96.7, that's perfect. And then the palms are a little warmer, which is expected, but even, which is great. And we don't lose any temperature of the arm. A little bit there. That's okay. So arms are a little bit cool, but I have been manipulating the hands, so they're going to be a bit warmer. Examine the skin. So you do have a few freckles here. You're very fair-skinned. So are you wearing sunscreen?
Not as much as I should.
Okay. Yeah, so especially because you have this freckling, we can get a melanoma anywhere. So I'm going to check it between the fingers especially. These are places that it could hide. And yeah, you are just, you're fair-skinned, and therefore you have to be a little bit more careful. And the hands are easy to forget because we're moving around, but they're often very exposed. So I want to take a measurement of this one. But it's flat, symmetrical, so it looks fine. It just looks like a freckle. Yeah, just keep an eye. I mean, that one's easy to see and easy to watch for you, so if it changes at all, just come on in and we'll take a look. The hands do feel a little bit dry. We can do a moisturizing treatment at the end. It is winter, so that's not to be unexpected. It's cold and you're getting a lot of exposure to the cold and the wind. Like I said, those tattoos look great. They're healing well. They don't look red or inflamed. They're nice and flat. How long have you had them?
Maybe 5 years.
Okay, so long enough where you know that nothing's going to change. Great. All right, we're going to move into testing for any nerve damage or pain. So if you lay your hands nice and flat, feel that little pulse. Let me know if you feel anything shooting, especially up into here. We have several nerves that run from the hands into the wrist, including one of the most commonly perturbed, which is the carpal tunnel. No shooting pains? That's okay. Do 2 more carpal tunnel tests. I want you to hold your hands like this. Kind of push them. They might feel a little tingly, but they shouldn't feel like completely numb. That's okay.
Yeah.
And flip it and do it the other way. Nothing there. Great.
Nope.
Do you have a desk job where you're typing on the computer
Yes.
all day? Okay, so something to watch out for. You're still quite young, so I think as you spend more time in that position, if you can get a little wrist rest, that can sometimes help. Some stretching can sometimes help, but you're not experiencing any pain right now, so kind of cross that bridge when we come to it.
Okay.
All right. So let's do sensory, and then we'll move on to more strength. I'm going to start off with, let's do this. A little cotton swab. I'm going to rip it in half. And I want you to tell me when you feel the sensation.
There. 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 There a little bit. There. 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 There.
Okay, I'll flip the hands over.
There. 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 There.
Okay. I'm gonna have you keeping your eyes closed. Tell me left, right, or both. I'm gonna touch you with one of these nice light cottons.
Left. Right. Left. Both. Both.
Good. Flip the hands for me, please.
Left. Left. Right. Both. Left. Right. Both.
Good. Okay. And one of these. Now we're going to do sharp or dull sensations. So this test, if you can feel different stimuli, I'll show you here on your chest. You see how that's dull? This is quite a bit sharper. Tell me what you feel.
Dull. Dull. Sharp. 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 Dull. Sharp.
Okay, flip the hands.
Sharp. 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 Sharp.
Do you feel the difference between this and this?
Oh, yeah.
Okay. So what does this feel like?
Okay, dull.
Mm-hmm.
Sharp. Sharp. Dull. Dull. Sharp. Dull.
Okay, that's fine. I actually think because of the dryness of your hands, it's feeling a little spicy because the hands are just a little irritated. So that makes sense. I'm not worried about you having sensory issues. Okay. Does that feel cold to you?
Yes.
Cold here?
Yes.
Same side to side? Okay, I'm going to hit this tuning fork. It's going to make a little buzzing sound. I'm going to place it on a couple of joints on the hand. Keep the eyes closed and just tell me if you feel a buzzing and when it goes away.
Okay. I feel it.
Okay, tell me when it stops.
Stopped.
Perfect. Same thing over here.
Feel it. Stopped. I feel that. Stopped.
Very good. And the last one here.
Feel it. Stopped.
Excellent. All right, so I'm going to say that's good for sensation. So now I'm going to ask you to do some working out.
Okay.
So I'm going to have you make some motions with your hands. So first, spread them as far out as they can go, and don't let me push them in. Keep them nice and strong. Very good. And then tight as a ball. Don't let me open them. Very good. Okay, relax. You can see how dry they are as well.
Yeah.
So we'll definitely do the moisturizing mask. Okay. Next, I want you to do like this, and don't let me pull them open. Up like this. Don't let me pull them down. And then push me down with your fingers. There you go. I'm going to have you lift each one individually. So start with your thumb. We'll do the same thing here. And now this one. That's okay.
One at a time.
That's all good. If you can lift it by yourself, then great. Lift this one, this one, this one, this one, and the pinky. Very good. All right. I want you to back and forth. Let's test some coordination. Any pain in the wrists with that? Okay, and you can kind of move all around, internally, externally. That's all okay. Some cracking there. Is that normal for you?
Yes.
Okay, yeah. Sometimes people have a little bit more crepitus than others. I do as well. So if it's not painful, I'm not worried about it. I want you to touch each finger, just like that, as fast as you can, back and forth. Okay. I want you to pretend this is a pen and hold it for me. Okay, great. Pretend to just write something. Okay, and now in your other hand, I want you to shake it as best as you can. Very good. So just testing some functioning and movement of the hands there. And you have no trouble like writing or...
No.
Okay, so I'm not going to worry too much about that. So the last thing I want to test on this side before we do a bit of a moisturizing packet, because I think the hands are okay, are just a couple, they're sort of sensory tests, they're sort of neurological tests, but it's going to involve me drawing something in your hand and you telling me what I'm drawing. So close your eyes, and it's going to be a number.
3.
And this is going to be a letter.
A.
Very good. I'm going to do the same thing on this side. Again, starting with a number. Let's just see here.
7.
And then moving on to a letter.
O.
Now, with this hand, relax that one for me, please. I'm going to be moving this joint down or up, and tell me which direction I'm moving in it.
Down. Down. Up.
Okay, over here.
Down. Up. Down. Down.
Awesome. Check your reflexes, and then... Just relax. Take a little close look at the nails. Actually, I see just a little bit of marking. No, it's okay. They're perfect. Okay, look straight ahead for me. Don't pay attention. Great. So I honestly think your hands are in really good shape. A good baseline for future exams. If you start having any pain, we can really easily see where the issue might lie and what's different. But I do want to put on a bit of a moisturizing mask because the hands are very dry.
Okay.
So let me grab a towel. Start with this one. Taking off any dead skin. I also have very dry hands, so it's just tough this time of year. Use some space gloves here. Just slip your hand in. Just relax that in your lap so I can take a look at this one now. I'll be back in just a minute. We'll get that taken off of you, but I want to let it sit for about 5.
Okay.
All right, Quinn. Okay, let's see how we're doing. Let's see. Good. I'm just going to moisturize this in here. Make sure you get the full effect. So yeah, the hands are feeling a lot healthier, which is great. I would suggest doing this every couple of weeks when you're just feeling that dryness and kind of spiciness in the hands. Okay. Great. So I'm going to log everything. I'll send you a report after the end of the day. Probably it takes like 12 to 24 hours to get put into the system and get sent out to you. But if you have any questions in the meantime, feel free to let me know. So we'll see you in probably, I'd say, 2 years.
Awesome. Thank you.
Thank you so much.